Hi everyone, Maya here, and today I'd really like to talk about moxa, specifically dispersive moxa, in relation to joint pain, joint arthritis, things like that. So we're going to talk about dispersive moxa. Before I get into that, though, we need to talk about how this substance can be not only tonifying for cold and deficiency, but also dispersive for things like heat and pernicious heat. And if you're unsure what pernicious heat is, if you ever read a classical text, it's something like whenever they put an evil influence or pernicious influence, they're actually talking about ki that does not do good for your body. And that's what pernicious heat would be heat that has pernicious ki within it. So we're going to talk about that today. And we're going to talk particularly about joints. So this conversation started because today I was teaching my ShinKyu University online Zoom course all about moxa that we teach every single month when you're part of ShinKyu University. And one of my students here that actually works with me in the office asked me, well, I have joint pain because I'm a massage therapist, have been for 15 years, and it really hurts and it feels achy in my thumb, is what she said. Now, she's not here right now, so I can't really show you her joint. But what I can do is show you pretty much what I did for her joint and how I taught her to treat arthritis in the joints. So the very first thing we're going to do is, if you watched last week's video, how to be more exact with your moxa using a Sharpie, actually, we're going to first plug my computer in here. We're going to first find some points on your thumb that or on that patient's thumb that have a lot more heat, more inflammation. And if you're a little bit more in tune with your palpation, you're actually going to be looking for that pernicious heat in particular. But if you're unsure what that feels like, really you just want to feel for the heat or the inflammation in the joint. If you still don't know what that feels like, ask the patient where they feel pain in particular, and you can just go off where they feel pain. So you're going to find those points, you're going to palpate, and then you're going to use your Sharpie. I already did because I was doing the same thing on an Instagram Live. And you're going to find those exact points and you're going to mark them with your Sharpie, kind of like I did here. Now, after you do that, you're going to take your moxibustion and do a dispersive cone on those specific points. So before I get into showing you how to do that, I just want to explain it a little bit. So a dispersive cone is literally a hot cone. So there's a lot of other things that Yanagi Asore, which is one of the more modern acupuncturists in Japan, but also a founder of Japanese meridian therapy, that delineated should be a dispersive moxa cone. But one of them, I would say the founding thought pattern should be that for a tonifying cone, it should be warm. It should feel like a warm bath. It should be gentle, feel very relaxing, rejuvenating. A dispersing cone should feel hot, kind of like a hot shower. I explain it like you touch a hot pan and pulled away before anything happened. Now, saying that, a dispersive cone is way easier to make than making a tonifying cone because you literally want it to be hot. And when you're first creating your moxa practice, almost all of your cones are hot. So it's not super hard to do. So I'm going to actually turn the camera down a little bit so you can see exactly what I'm doing. So of course, I have my moxa here. I'm going to have my ashtray here. I've already put my dots where I feel that there's going to be this pernicious heat. I don't have any, but just to show you for an example today. Now, before you actually start with your practice, you should always have the patient move, especially for pain, right? That's initiated on movement. You want them to move or somehow try to initiate and feel the pain, feel how it feels, so you know the before and after. Then after that, notice one thing I am not, didn't hold that correctly. I'm not using the boards to roll my moxa. I'm using my fingertips, and then I'm going to take a little bit of moxa. Again, it should be a nice little Mount Fuji cone, a little half grain cone, and I'm going to burn it directly on the point. Now, when I say directly on the point, it should be straight on top of the point that you have marked. And this means that you're going to have to be super exact about where you place your moxa. Notice as well that I'm not using any cream underneath. Now, there's a few reasons for that. One, it's a little bit of cheating. But originally I did use cream when I was originally first learning how to create moxibustion in clinic when I was assistant. But it is cheating once you're an acupuncturist. You shouldn't have to use the cream to make it stand up on the skin, nor should you need it as a buffer for the skin. And so what you're doing is you're creating this nice little Mount Fuji cone. It's going to be a half grain of rice, and then you want it to burn directly on the skin rather than using the cream. Now, the reason for that is not only do you get a higher heat shock protein response, which is actually what we've found out through Western medicine, what happens when you burn moxa. So the heat shock protein response is an immune system response on the biological molecular level. So at the all of the molecules and all of that below, all the cells below where you're burning that moxa are going to create this heat shock protein, and that's going to initiate the endocrine system to start creating releasing good feeling hormones and healing hormones, and it's also going to initiate the nervous system to go from sympathetic, to parasympathetic, and then on top of that is going to initiate the immune system to create a high level of white blood cells and get fresh blood and oxygen to that area. And so all of those things combined are going to rush to that area, and then it's going to create a healing response. And of course, in our medicine, we say that the key rides on the back of the blood. So with that fresh insurgence of blood to this place of inflammation, we're going to actually have a lot of healing response, which is great when you do have that inflammation with the arthritis. Now, if you want to go a little bit deeper into arthritis and think about the theory behind it, because this is a very local treatment, think about what's happening with arthritis. So the first thing that's going to happen, right? So we're going to have our joint. Let me get a pad. We're going to have a joint that has a lot of heat created within it. Now, when this heat gets created within the joint, right, it's going to happen because we have some type of resistance within the joint, right? And so usually what happens is you have this influx of ki, of energy, this pernicious ki. Now, this pernicious ki is going to be attracted there either because of something that's happening within the joint or from something that's happening within the meridians. There can be a lot of different reasons for that. And then what it's going to do, and for example, if you have like bone on bone, you're going to have friction being created. And that friction is going to start creating heat. And so what happens then is the body then is going to create water, and it's going to send water to that joint. And it's going to try to encapsulate that joint with water. Now, when it does that, that's often what we get, like water on the knee, or we start to get that swelling in the joints, right? And what often happens in Western medicine is they'll go in and they'll actually, with a needle, try to suck out that water so that you don't have water in the joint and you're relieving some of the pain. Unfortunately, what's left, since we haven't done a treatment to remove the heat, what's left is that heat. And the heat starts to eat away at the joint, and it starts to deform the joint even more. And that's where usually when you get in touch with the arthritis, it's usually at that point because the heat is already starting to create those deformities in the bone. So ideally, when you start to have pain, you're going to insert a needle very quickly, disperse, and then you're going to do a little bit of hot moxa on that point to, again, disperse the heat, because a quick amount of heat is actually, which is counterintuitive, is going to actually get rid of some of the heat. So it's really important to understand, of course, what's happening within your client's body. It's also really important, that theory part, of course. It's also really important that you have your hands dialed in and you have the technique to not only be able to palpate what's happening in the joint, but also the technique to be able to actually apply the technique, right, and do the treatment that's going to get rid of, for example, this heat and inflammation in the joint when you come to arthritis. And do it in a way that doesn't scar them, because moxa can be scarring, so you want to be very careful about that. This is all things that I really do go on one-on-one basis within ShinKyu University. I would love to learn with you and practice with you your moxibustion. If you're interested in learning more about how you can refine your moxa practice and create a better moxa practice so that you can be more confident in your treatments and give better treatments to your clients that are more successful, I highly suggest joining ShinKyu University. You can put in the comments below if you would like to set up an interview. I would love to talk to you. So with saying that, I'm going to just remind you to not forget to like, subscribe, and hit the little bell to be notified of future videos that are coming out on this channel, all about Japanese acupuncture, moxibustion, palpation theory, and so much more. I'm very excited to learn with you in the future. And I have a moxibustion moxibustion in-person live workshop happening in September here in Colorado. I would love for you to also join that. You do not have to be a member of ShinKyu University, although you will get more advanced teachings if you are. Okay, so that is it for today's Live Wednesday. Thank you so much for joining. Again, don't forget to like, subscribe, and hit the little bell. Talk to you guys all soon.